so many interruptions on Facebook. Okay, we're gonna dive into part 2 of this and just try to keep going. Please do tell me if you can hear me, and we're gonna continue. So, as I was saying, we have these hearing tests where some can be automatic and some require the participation of the child, whether that means that they're looking at lights every time they hear a sound and we're conditioning them to look at those lights, or we're teaching them to play a game with blocks that they have to build, or something that they have to throw. So within this category of hearing tests or diagnostic tests, we're getting information about how much hearing loss there is, what kind of hearing loss, and getting the diagnosis. That's like step 1. And now, many times, if a hearing aid is recommended, then there's a series of appointments, not just one hearing aid appointment where you're given a hearing aid and you can walk out, just like with glasses. It's very, very different than glasses. In fact, it's something that takes many weeks and sometimes several months in order to adapt to and get used to and really be able to get the benefit from. So in the hearing aid stream of things, there's first a hearing aid evaluation appointment where the family comes to pick out the right kind of hearing aid, which style of hearing aid. A mold will be taken, an impression of the ear, so that a mold of the hearing aid can be made to be exactly right for that ear. And also, you'll pick the color, you'll pick any other kind of accessories that come with the hearing aid, and you'll get ready and get a lot of information about what it's like to come back for all of those programming appointments, and to get information about what the journey is going to look like. Come back a couple of weeks later, maybe 2-3 weeks, when the mold is ready, and get fit with the hearing aid. That means the hearing aid is first put in, it's programmed specifically to the hearing loss of each individual person, and also you're going to be able to show how to use the hearing aid, how to put it in and out, how to change the battery. So all of these things are going to happen within this first fitting appointment, and then there's going to be a follow-up 2 weeks later or so where they're going to check, are the hearing aids functioning properly, are you able to handle all the different pieces, and also fine-tuned, changing a little bit of the settings. And that's going to continue to happen in series that keep getting stretched out and stretched out. So in the beginning, it's maybe every 3 weeks, and then every month and a half, and then maybe every 3 months and 6 months, and then it can become more spaced out as everybody's getting used to using the devices. But it is absolutely not just putting the hearing aid in and then walking out being all totally fine and ready to use them and everything. It's a process. And I think the idea that there's, first the diagnostics and then picking what we're going to do and then implementing what we're doing, that is like a train, a series of things that need to happen. If there is the cochlear implant route, if that's something that your family has chosen for the child, then that is also a whole different series of things that need to go on, not only for candidacy to see if cochlear implant is right for this child and for your family. That includes hearing tests and all sorts of audiologic testing, but also medical testing like an MRI and a CT, and just medical testing overall to make sure that the child can withstand the surgery and the anesthesia. So these are things that are going to happen within these first couple of appointments. And then there's the surgery, which is a very big deal. Nobody is taking that lightly. The first activation appointment is usually around 4 weeks after the surgery, and that's when the processor is fit to the outside to stimulate the implant for the first time, and the brain and the nerve. And this appointment can be pretty overwhelming because it's the first time that there's sound coming in, and there's a lot that goes on in this appointment. It's really quite emotional for many people, and overwhelming as well. And not only that, but sometimes what's so frustrating about that appointment is that people maybe just feel what's happening, or if we're activating a baby and we're doing an activation or a switch on with a baby, they're going to cry. And even though that's telling us that they're receiving some perception of this cochlear implant, it's not a very nice thing to keep stimulating this child to cry and cry. And it might be a difficult thing to just get used to what this new stimulation feels like, what it sounds like. From adults who go through the cochlear implant activation, we hear from them that they often say it feels like something rather than them hearing something. They can actually feel or have some sort of perception of like static or of numb or tingling or any of these things that then over time their brain will process as incoming sound. But in the beginning it can be very uncomfortable and unusual, and if they do hear sounds, they sound really tinny and robotic. So anyway, I'm going off topic because what I'm talking about is the series of appointments where there's going to be the activation and then the 2-week follow-up and then a 1-month follow-up and 3-month follow-up and 6-month, and a continuous journey, a whole series and process that's going to be coming. And I think one of the things that happens when there's a new diagnosis is that there needs to be a focus on this whole first getting the diagnosis, which can take 1 or 2 or 3 or 4 appointments to even just get that, and then to choose what to do in terms of hearing aid, cochlear implant, or other kinds of intervention options. There are so many kind of different moving parts that it's very difficult to sit down with someone and say, okay, here's what's going to happen, A, B, C, D, E, F, G, because there's lots of different moving parts and options and decisions that you yourself can make, that the family needs to make for them and for this specific child, also in terms of communication mode and language and all these other things that fit in. So for today's topic, what I wanted to talk about is how to prepare for the hearing test appointments or for any of the appointments that you're going to have with your audiologist. And I'm going to talk about 3 important things. Number 1 is the timing and the scheduling. For very young babies, we want them to be sleeping when we're doing that ABR test, that automatic test. And if they aren't sleeping, then we're going to try to get them to sleep, feeding, walking around the neighborhood, come back, try to get them to sleep. But this is something that needs to be communicated to you, and you should be ready, because if you're coming to an appointment, this happens. People come in and say, oh, the baby just slept for 40 minutes in the car ride here, and now they're not going to sleep for another hour or 2 hours or something. So being prepared for what kind of appointment it is and understanding what is going to be required of you is really, really important. Whereas if you're coming in with a toddler or a 2 or 3-year-old that's super rambunctious and excited and going to cooperate and play with you first thing in the morning, that's great. But do not make a 4:30 p.m. appointment for a hearing test where you're going to really need the child's participation. So trying to time the appointment for when your child is at their best, for when everybody is fed and comfortable and ready to engage with what's happening as much as possible, to the extent that that's possible. The second thing is about bringing a comfort item. And if you know any little kids, you know that they usually have something that they're attached to, a specific doll or teddy or blankie, and it can also just be something in their day-to-day life that isn't sentimental, like their bottle. Actually, my daughter is really attached to her bottle. She's 18 months old and she just walks around with it, dangling it from the top. She won't let go of it, whether or not she's drinking. She just likes to hold it. So for some kids, that's their pacifier. So please do not leave this comfort item in the car or at home. Bring it with you to the appointment so that the child is as comfortable as they can be and really engaged, and we're able to play with them and try to get as much information that we can out of them in terms of testing. But also at all those other appointments, there's a lot of information being given over to the parent, and we want to make sure that they're able to engage with the audiologist appointment, and that they are not constantly redirecting a cranky child if that's the case. So and that's number 2, bringing in a comfort object. Now this one is a little bit I understand the constraints of real life, but as much as possible, if you're able to bring another adult with you, if you can bring another adult to the appointment and to any of these testing or fitting appointments, because what ends up happening is that one adult can focus on the stroller and the snacks and all of this, and the other can really focus on, okay, what are the things we need to know or do with this new device, with the batteries, and maybe take notes and be the person who's getting the information, where the other one is maybe with the child. And this can be, you know, any family member, an aunt, a grandma, a cousin, you know, anybody who can come with you to help with the process. And, you know, these 3 tips of scheduling for a good time and bringing a comfort item and trying as much as you can to bring another adult with you, these really apply to any appointment and across the board for any kind of specialist, but really at the time when you really need to be engaged and focused and present with everything that's going on in the audiology. I really recommend these things to prepare if you can. And now my last tip that I'm going to include here is for those appointments where you're getting a lot of information about a device. So either the hearing aid fitting, where you have to know how to clean it, how to change the battery, put it in and out, or with the cochlear implant, which also has a lot of moving parts, and understanding how they work, how you're going to maintain them, how you need to clean them, how you need to charge batteries, all these details. My big tip is to bust out your camera. We've all got smartphones, and take some short videos or pictures of the things that you're learning as you go, because the audiologist is going to explain a lot of things, and even taking a quick video of how they put it in and over, you know, showing the different parts of how to put in a hearing aid. You know, there's like different steps. So if you have a 10-second clip of how the audiologist did it, then that can really